We're going to study about the anaphylactic shock, which patients sometimes it happens to the patients in the dental procedure. So let's start it. Bismillahirrahmanirrahim. So first of all, the most common is actually the exposure to the antigen to which the patient has been sensitized. That is the most common. Some patients are allergic to like drugs like penicillins, latex gloves, even local anesthesia, but it is very uncommon. The quicker the onset, the more severe is the reaction actually is. The patient can have, if the reaction after start 30 minutes, it is not that much dangerous. The collapse is due to widespread of vasodilation and increase the capillary permeability and causes potential fatal hypotension. Now, what are the signs? The patient has excessive sweating. Facial flushing means initially started, then edema of face and neck, altered sensation like paresthesia, numbness around the mouth and fingers, urticaria very common, pallor going cyanosis will accompany acute breathing difficulties like bronchospasm, loss of consciousness. Patient suffers from that rapid, weak or impermeable pulse. Sometimes patient has actually cold, clammy skin. The patient severe hypotension, cardiac arrest if the treatment is delayed or inappropriate. Okay, how you manage? First, you will lay the patient, then you will raise the legs to improve the cerebral blood flow actually, then give 0.5 to 1 ml of epinephrine by IM. Repeat every 15 minutes until the patient is not stabilized or response. 10 to 15 chlorpheniramine slowly in IV. Give 200 milligram of hydrocortisone succinate IV, and maintain airway and administer oxygen and call. Okay, but always remember, first of all, you have to stop all the dental treatment, lay the patient, give epinephrine. Always remember, epinephrine is always the initial first line of drug in anaphylactic shock. It is always, if someone asks you what is the immediate, what you will give in anaphylactic shock, epinephrine you will give. Okay. Now, then you can also give actually, which is second line drugs like chlorpheniramine and also hydrocortisone. Okay. Then also we have the patient sometimes even have a stroke. Those patients which are actually hypertensive, or those patients which are basically in middle age or elderly, the picture varies according to the site of the brain. Sometimes it can cause due to ischemia, means reduced blood flow. Embolism, emboli is formed. Sometimes hemorrhage is due to thrombus in the cerebral artery when the subarachnoid hemorrhage occur. Why? Because there is rupture of the berry aneurysm on the circumvallus, which is the main cause of stroke in young patients. Headache, which from mild to worse pattern. A stroke patient has weakness of an arm, leg on one side, means hemiparalysis. Dropping of side of the face. Dysteria means slurring of speech. Hemiplegia means that unilateral paralysis. And emphasia means inability to speak actually. Difficulty in breathing or swallowing. Both. A patient has loss of bladder control. Seizures, visual disturbance. The patient experiences dizziness and partial total loss of consciousness. How you manage the patient? Terminate all the dental treatment. Have someone medical assistance call. Position the patient supine posture with head slightly raised. Very important point. In all we have said, not this. Okay. In all management we have said that raise the legs above the cerebral floor, but here you will actually raise the head little. Okay. Monitor the vital signs. Give oxygen if respiratory difficulty develops. Patient has actually maintained the airway. If loss of consciousness, start the basic life support. If necessary, call an ambulance for transfer to hospital.